Good morning, ladies and gentlemen. My name is Mike Seward, and yes, I am proud to serve as the president of your Bay Area Chamber of Commerce. I'm proud because, in part, of the kind of programs and services your Bay Area Chamber of Commerce offers its members on an ongoing, regular basis. Today, we are here to participate in one of those programs and to learn about one of those services that your chamber works on behalf of the entire business community throughout the Bay Area. Today, you're going to have an opportunity to learn about how to navigate healthcare reform. We've all heard about the Healthcare Reform Act, aka Obamacare. We all, I believe, have concerns in a variety of ways, but we know one thing, and that is this new legislation that is now an act is going to impact every one of us one way or another. It doesn't matter the kind of business, the size of business on the one hand, or because you know if it doesn't impact you directly, it impacts your employees, and you're going to need to be able to know things to be able to talk to them about this particular program. This program, incidentally, is sponsored by Blue Cross Blue Shield of Michigan, and I want to particularly recognize Lois Dent and Kevin Harrison from Blue Cross for their outstanding working relationship with your Bay Area Chamber of Commerce. Thank you so much. In fact, I would just mention at this particular point, we didn't put a lot of information out for you today regarding the Chamber and the various programs that we have, but we did have one thing in addition to the agenda for today's program, and that is an information sheet regarding the insurance programs and services that is offered directly by your Bay Area Chamber of Commerce, and also a listing of the member insurance agents that can help provide you with those services. Those services include the accident fund insurance program that you can have for workers' comp through the chamber. It also includes the Blue Cross Blue Shield program offered to members of the Bay Area Chamber of Commerce, as well as the other efforts that you can see on the back of this particular sheet. At almost every event we have, we like to recognize the premier sponsors of the Bay Area Chamber of Commerce, because they make a major investment in this organization that provides us an opportunity to provide good quality services to the members of the chamber at a very low cost, such as the program that we have today. And these premier sponsors include First State Bank, Bay Valley Resort and Conference Center, Chemical Bank, Consumers Energy, Covenant Healthcare, Cumulus Media, Do All Incorporated, Financial Edge Community Credit Union, First Merit Bank, General Motors Powertrain, Independent Bank, McLaren Bay Region, Michigan Sugar Company, MLive Media Group and the Bay City Times, MyBayCity.com, Spence Brothers Incorporated, the Dow Chemical Company, Three Rivers Corporation, Uptown Bay City, Wildfire Credit Union, WNEM TV5, and Wolverine Bank. Again, let's thank them for There's another organization I want to recognize at this time, because when we're putting together programs like this, we make a call to a gentleman by the name of Harold and say, Harold, would you be available to come out on a good educational program that we have to televise this on Bay 3 TV? So Bay 3 TV, which is a great friend of the Bay Area Chamber, a great friend of the business community, we want to thank you for your participation. You will, at a later date, also be able to view this in full on that particular station. Now it's my honor to bring up the MC of today's program. He's the chairman of the group that actually put together this particular program for your chamber, the chairman of the Health Services Committee of your Bay Area Chamber of Commerce. Ladies and gentlemen, my friend Blair Moulthrop. Blair.
Thank you, Mike. Today we put together a 3-person panel to go over healthcare reform. What we're going to do is bring up Alisa Bennett, and I'm going to introduce her just in a second. She's with Blue Cross and Blue Shield. She's going to do the main overview. Then we're going to bring up McAnelly from Rehmann and Gudmundsen from Braun, Kendrick. So right now I want to introduce Alisa Bennett. She's the manager, Group Business Healthcare Reform Team with Blue Cross and Blue Shield of Michigan. Alisa is a graduate of the University of Michigan Dearborn, where she earned a Bachelor of Science and Arts degree in Health Policy Studies. In addition, she holds a Master of Health Services Administration degree from the University of Michigan Public School of Health. Her newly formed department at Blue Cross and Blue Shield is positioned to share the impacts of the healthcare reform law with external stakeholders, especially group customers like us, and to assist an internal sales force with readiness by supporting training needs. At no further ado, I'd like to bring up Alisa Bennett.
Good morning, everyone. Good morning. I'm so glad that they had a nice breakfast for you, because we have a lot of information that's going to be food for thought, and you're going to need something to settle your stomach. So we're going to go on a wild ride here. So, as Blair mentioned, I'm from Blue Cross Blue Shield. I've been there for about 11 years, and I've spent the last 2 in the group business area, focused on healthcare reform and how the Affordable Care Act is going to impact all of our customers. And as many of you know, depends on what size you are, how much of an impact you'll feel, but without a doubt, everyone will have some type of impact. So, we have several speakers, and I don't want to impose on anyone else's time. And I have a lot of slides, but we're going to move through them rather quickly so that we can bring up the other speakers who will come, and they will reinforce some of the more important elements of the overview that I'm going to cover today. So, without further ado, I'm going to jump in. Here's the clicker. Okay. Let's see how we're doing. Okay, great. So, the first thing I need to say is that today's presentation is an educational tool only. The information that is included here is provided by Blue Cross Blue Shield about healthcare reform, and it's based on our interpretation of the law and should not be considered legal or tax advice. Federal regulations and sub-regulatory guidance is released on a regular basis, and this presentation is based on what we understand to date. And I shouldn't have checked my email last night, because I found out there are even more changes coming up. So. All right, so here's kind of our agenda for the overview. I'm going to talk about the new marketplaces and the subsidies that will be available exclusively on those marketplaces. I'm going to cover some of the reform mandates that you need to be aware of. We're going to talk about group definitions in light of the ACA. There are a lot of mindsets that need to change in terms of what a small or a large group is because of their definitions changing in the law. And then we're going to cover some rate and benefit standards that are going to change, and these will cause some disruptions in terms of how you'll see the information that you usually get from year to year. But first, we're going to jump in and talk about the ACA and what it intends to accomplish. So there are 4 major objectives that we felt really emphasize the key areas that the healthcare law was trying to address. And what you see on your right is those 4 mechanisms, or the mechanisms that are a direct response to those objectives. So first, the law intended to expand access to qualified coverage to millions more individuals. We know that the uninsured problem is very large in this country, over 40 million people without insurance, and more than that number who are underinsured in some respects. So what the law wanted to do was remove some of the barriers that prevent people from accessing coverage today. One is guaranteed issue. making sure that anybody who applies for coverage has access to it. Also, subsidies. So at no time before have we seen the ability for people who make a certain income to have access to financial assistance from the government. We haven't seen that since the time of Medicaid being introduced for the very poor, but nothing for the middle class, so to speak, or those individuals who make what some would call a decent living, but still find that purchasing health care insurance is still unaffordable to them and their family members. The other aspect is that there will be mandates and that there are eligibility expansions. So we're still waiting to learn what the state is going to do with regard to Medicaid, but the law created an opportunity for every state to expand Medicaid eligibility up to 138% of federal poverty level, so that those individuals who fall in this category would have access to coverage where they hadn't before, and they would get financial assistance as well. The next objective is to simplify product choices. So many of you in your daily work probably have a working knowledge of how to choose an insurance plan and make an effective decision. But the average person, if you sat them down and put plans in front of them and you started talking about deductibles and co-pays and co-insurance, they'd probably start either rolling their eyes or looking very, very confused. So what they've attempted to do is create simplified product choices, especially in the individual and small group markets, so that it would be easier for an individual to go out and to be able to compare plans one to another. And we'll talk a little bit about these metal tiers and what those symbols will mean to consumers in the future. The next element is regulating insurers. So in the past, we've heard stories about unsavory practices, unethical practices among insurance companies, usually for-profit insurance companies, not like Blue Cross. That is not for profit. But the intention here is to make sure there is a level playing field. So they're introducing community rating, standardizing the benefits that are available so that across the board individuals have access to similar benefits, especially those that are deemed essential. And there's also risk stabilizers that will help stabilize the market going into the future. So in the individual market in particular, we're not certain who will choose to purchase insurance because of this mandate or because of the subsidies that are now available. So they've created some risk stabilizers to make sure that there's not too much volatility in that market. And then finally, shared financial responsibility. They felt that this would be more effective if everyone had skin in the game, so to speak. So whether you're in a group plan today, whether it's small or large, or whether you're an individual, everyone will be contributing something toward the cost of health care coverage across the board. So everyone has a stake in the game, and that's going to be evidenced by taxes and fees that you haven't seen before, mandates, and again, these metal levels have, again, contributed to making sure that everyone has a shared financial responsibility. So we're going to move quickly through the remainder of these slides. That was just to give you an idea of what this law was intended to accomplish. The first is one of the mandates, and this is something that we wanted to make sure we put out in front of you right away because groups need to comply by October 1st with their existing employees. So this first mandate is regarding notifying your employees that the marketplace exists. The ACA requires employers to notify each employee at the time of hiring and existing employees not later than October 1st of 2013 that the marketplace exists, including a description of the services provided by the marketplace and the manner in which the employee may contact the marketplace to request assistance. Next, that notice has to communicate to the employee that if the employer plans share of the total allowed costs is less than 60% of cost, the employee may be eligible for a premium tax credit on the marketplace. Next, it also has to include that if the employee purchases a marketplace plan, the employee may lose the employer contribution, if any, to any health benefits plan that's offered by the employer, that some or all of that contribution may be excludable from income for federal income tax purposes. The employers have to do this automatically and free of charge, and employers must provide a notice of the options to each employee regardless of whether they're full or part-time employees, whether they're enrolled in a plan there or not. And the Department of Labor will consider the employer compliant with new employees as long as this is done within 14 days of them hiring the employee. This guidance was issued in May because employers said, you know, hey, you haven't told us what we need to do and we're supposed to do it by October 1st. You haven't given us any language to use. And the other problem with this is that we don't have any details about the marketplace in terms of what the website is going to be, how certain transactions are going to work. And what I read last night was that the application to apply for coverage on the marketplace has also changed. So things are very much in motion around this right now, but we wanted to communicate to you that this is a responsibility you have. These model notices are available to you, and the links that I have here are for the model notices that the Department of Labor issued for plans that offer coverage, for employers that will not be offering coverage, and also for those who need to provide notices to terminated employees who need covert election information. Okay, so although we don't know a number of things about the marketplace, here's what we do know. We do know that there will be two separate marketplaces, one for individuals and one for small group employers. We believe that they will have a seamless appearance, so there may be one website that's available, so you'll have one entry point, whether you're an individual or a group, but they will exist separately, somewhat behind the scenes, because there are different rules that apply to each of them. So first we'll start with the individual marketplace. It is going to be open to all individuals in 2014. Enrollment is set to begin October 1st of 2013 for coverage that will be effective in 2014. Individuals must choose metal compliant qualified health plans. So that's somewhat a loaded statement because what a qualified health plan is up to the plans. That's something that we're doing at Blue Cross, is making sure that our products are compliant, and we're filing with the state to make sure that we are deemed qualified health plans in order to be able to offer coverage on these marketplaces. The other aspect is that there are these new subsidies and tax credits that are available, and specifically they are available to individuals with income between 133 and 400% of the federal poverty level. So for those individuals, they will have access to a sliding scale premium tax credit. For other individuals who fall between the income brackets of 133 to 250% of the federal poverty level, they will also have access to cost-sharing subsidies if they purchase a silver product on the marketplace. In order to gain access to these subsidies and tax credits, you must access them through this marketplace. So you can't go directly to a plan or to a plan's website and expect to receive these subsidies or tax credits, because they will only be offered on the marketplace. When it comes to the group side, so this marketplace is called the SHOP, and the SHOP stands for Small Business Health Options Program, but you'll hear that term quite frequently, the SHOP, and that is referring to the small group marketplace. The rules on this are slightly different. It will be open to all small groups who have 50 full-time equivalents or less in 2014. 2014, employer chooses one product for employees. So in the past, what was presented was that employers would be able to choose one metal tier, and the employee would have the opportunity to choose the plan within that metal tier. That functionality is not going to be available in 2014. So in 2014, we don't expect to see a large number of employers going to the marketplace because of some of the limitations in the functionality that were originally promised. It will expand to groups up to 100 full-time employees in 2016, and the state has the opportunity to expand it again to large group by 2017 or later, but that is something that is an option of the state. In 2015 and beyond, we expect for that functionality to return so that employers would, again, choose a metal tier, and the employee would be able to choose whatever plan they want within that metal tier. The people that, or the groups that we think will find the small group marketplace attractive are the very small employers who may be eligible for tax credits on the small group exchange. So if you're up to 25 full-time equivalent employees and the average annual income is less than $50,000 and you're paying at least 50% of the employee's premium contribution, and you're purchasing on the shop for your active employees, then you are eligible for the small business tax credit. The tax credit is actually available right now, and we're not seeing a lot of employers taking advantage of it. So again, we don't think there's going to be a huge amount of traffic on the small group exchange, but it's all something that's up in the air. We're just making some predictions, but we really have no way of knowing how attractive this option is going to be in 2014. But it is available and is set to launch. So I talked a little bit about some of the standardization that is going to be available on these marketplaces. So I wanted to talk to you a little bit about essential health benefits and the metal tiers. These are the two areas where it's helping to simplify choosing a product for those individuals who may be uninsured and have never really sought coverage before. They would be completely overwhelmed, and what these metal tiers in particular are supposed to do for the consumer is allow them to kind of choose if they want a bronze plan. It is usually a lower cost plan in terms of the premium, but they would have to pay a higher amount at the point of care. So these metal tiers are associated with actuarial values. And that's just a big term that talks about what is the benefit cost? How much does that plan really cover? How much value does it represent? And for a bronze level plan, the target is 60%. So 60% actuarial value means the benefits are about 60%, so that the individual or the person who has that coverage would then pay 40% of the remaining cost. What the government did was said, you know, the target is 60%, but you can only design your plan. You can't do a lot of tweaking. The plan has to be 60% plus or minus 2%. So you can't, you know, increase the copay over here to get it to be 65%, or you can't play around with it too much. And they wanted to do that intentionally so that it would be easier for people to compare one plan to another. So if you're looking at a Blue Cross plan next to a HAP or a priority plan, and they're both bronze level plans, then you have some assurance that they're very similar in terms of the benefit structure because they all have this similar actuarial value. So hopefully that explains that. The next level would be silver. The target is 70%. Higher than that would be gold. 80% actuarial value is the target there. And then 90% being the platinum. And that will have, again, a higher cost in terms of premium, but a lower cost in terms of paying at the point of care. So it really is up to the individual what they prefer. And even if you ask people, I ask my coworkers all the time, and we talk about which plans we choose at open enrollment time, and it really is just an individual preference. It has nothing to do with your knowledge. It's when do you want to have to pay? Would you rather pay more at the front end or the back end? And it'll be interesting to see how people choose which metal tier. In these plans, they'll have 10 categories of essential health benefits, and these were defined by the federal government, but as this moved along, as this conversation proceeded, they really said, we'll let the states determine specifically what benefits that includes. So we'll give you the categories and the high-level structure, but it will be up to the states to determine. So the state decided that they would choose a benchmark plan, and we're now working to make sure that our plans conform to the benchmark and include those benefits. And then just a quick word, there will be a catastrophic plan available for young adults that has the equivalent of a 30% actuarial value. And there's some limitations about who can purchase that kind of coverage, but it will be available for some. Okay, next we'll talk about shared responsibility. So I mentioned at the beginning that that was a key objective of the law, that everyone has some skin in the game. So again, we'll start with individuals. The individual mandate says that all individuals need to prove they have qualified coverage through their tax returns. And if they cannot do so, there will be a penalty imposed. In 2014, the penalty initially will be the greater of $95 or 1% of household income. So if you recall the Supreme Court conversation and the ruling, a lot of the argument was around the mandate not being strong enough to compel anyone to purchase health care coverage if they haven't done so far. Most of you know that if you wanted to find an individual plan, you'd be hard-pressed to find one that cost $95. So this mandate is not going to be a key driver, in our opinion, of people going to the marketplaces to purchase coverage. They'll say, I'll pay the $95. I'll just go without coverage for another year. They may feel differently as the years progress and as that penalty increases. So in 2015, they will pay the greater of $325 or 2% of household income. In 2016, they'll pay the greater of $695 or 2.5% of household income. And I believe it's also going to be indexed and continue to change until it reaches a certain point. So the key here is that we're going to give people time to conform to this new responsibility. We know that if they haven't purchased coverage before because it was unaffordable, they may not be compelled, but as the years go on and the penalties increase, they may change their minds about purchasing coverage. In the group space, if your group is under 50 full-time equivalents, there will be no requirement that you offer coverage to your employees, and there will be no penalty if you decide not to offer coverage any longer if you have in the past. The other point for large group, those who are 50 or more full-time equivalents, there's what we've called the pay or play mandate, but it really is called an employer shared responsibility payment. And if you have more than 50 full-time equivalents, you must offer qualified coverage of at least 60% actuarial value to 95% of your full-time employees. And this applies to self-funded and fully insured groups. The payment is triggered, though, when any full-time employee obtains tax credits on the individual marketplace. And I'm not going to spend a lot of time on the scenarios we have on the next page, but I wanted to make sure that this is stated because this is really important. It's going to be reiterated in one of the other talks. The next point is that there are two different penalties depending on whether you don't offer coverage at all or whether that coverage is considered unaffordable or low value coverage. So again, this applies to large employers who have 50 or more full-time equivalents. They have to offer that coverage to at least 95% of their employees, and it has to have a minimum value. So you'll hear that term if you represent a large group. You'll hear the term minimum value, but what they're referring to is that 60% actuarial value. Most plans, they've done some research, and most of the plans that exist today in the large group space meet this requirement already. But there are some tools available to be able to check and make sure that the plan you offer meets that minimum value standard. And I'll save the rest of those comments about this for another speaker. And we'll just talk briefly about how this penalty applies. So, if you have, in these scenarios across the board, we have 60 employees represented. The one that's gray, that column that's gray, if you have less than 50 full-time equivalents, and I'm using that intentionally because full-time employees and full-time equivalents are different terminology, and there's a different calculation around that. But full-time equivalents, if you have less than 50, this doesn't apply. There will be no penalty for not offering coverage. In scenarios A and C, you'll see that in scenario A, that employer does not offer coverage, and in scenario C, they do. But the point I want to make there is that for scenarios A and C, there's no penalty because no one, I'm sorry, I'm not on the right slide. And I can't see from here. There we go. No. Yes, okay. Is the right one? Yes. Okay, good. Sorry about that. For scenarios A and C, neither one has a penalty that's levied against them because no one received a tax credit or subsidy on the marketplace. So as long as none of your employees go to the marketplace and get coverage there, that employer will never have to pay a penalty whether they offer coverage or not. The next more complicated situations are scenarios B and D. And in those cases, in scenario B, the employer does not offer coverage even though they're a large employer and should be doing so. They have one full-time employee who goes to the marketplace and gets a tax credit. They will then pay a penalty that is $2,000 times the number of employees they have less 30. So 60 employees, they get a 30 employee disregard. So it's 30 times the 2,000. They'd have to pay a penalty of about $60,000. And what you'll see in comparing this to scenario D, where the employer is offering coverage, they have 10 employees who go to the marketplace and get a tax credit or subsidy, and they will pay the lesser of the two different calculations. And in this case, they would pay 10, the number of employees who actually got a tax credit on the marketplace, times 3,000. And in that scenario, you'll see they're paying $30,000, even though they had more employees who went to the marketplace and got a tax credit. But the key here is that they're paying for only those who got the tax credit. They're not paying for all of their employees because they're offering coverage. And I think this exposes the government's intention is we're not trying to put you out of business. We want you to do your part as employers. We want you to offer coverage to your employees. And if you don't, we're gonna have to collect from you in another way. So it's really up to the employer whether they want to take the chance of having to pay this large penalty for not offering coverage and pay that penalty for every employee you have, less 30. And then, or if you want to take your chance that you're offering some level of coverage, that you may have some employees who are full-time who go to the marketplace, you'll pay substantially less in these scenarios for those employees as opposed to having to pay for all of them. Okay, so I wanted to mention one more time about the difference in the group definition. So previously, there's been a lot of references to full-time employees, but in this new calculation, you need to count the number of employees you have using your full-time employees, but also including part-time employees in that calculation. So this is how you determine whether or not you're considered a small employer or a large employer, is using this new calculation that includes the part-time workers. The small group definition will increase in 2016 to 100 full-time equivalents, and it will use, again, this calculation methodology unless the government uses their prerogative and changes it again, which they've been known to do. This is the way going forward that you will calculate and determine what your number of full-time equivalents is and whether you're considered a small or large group employer. Another note is that there are a couple of categories that have been defined differently by the law and no longer are included in the small group definition. True sole proprietors without a common law employee enrolled in coverage that the sole proprietor sponsors, they're not included in the small group definition any longer, and they will be in the individual market. And direct billed association business, and this direct billed association business is a referral to Blue Cross. Okay, it's hard to see from here, but we should be on the rating standard slide. Is that what's here? No. There we go. Okay. Rating standards. So there's going to be a lot of disruption in this area for the small group market. In particular, guaranteed issue is not going to be a problem for Blue Cross. That's something we've always done, is offer coverage to those who apply without regard to pre-existing conditions. But that is a new criteria for some insurers, and they will have to comply in 2014 across the board. When it comes to rating standards, age will now be 3-to-1 as opposed to 5-to-1. And that's the spread between the oldest person on the policy and the youngest. Tobacco use, they're introducing a tobacco surcharge for smokers, but that is optional. Geography, family size is also going to be a part of how rates are determined. But they're going to remove industry factors and the CCF max. And that is going to cause a lot of disruption, but it will mean different things depending on what type of group you have. So some groups may actually see increases, some may see decreases depending on what those industry factors or that CCF max did to your rates previously. The next change is that there will be an allowance for member level rating. So each person on the policy will have their own assigned rate, as opposed to having a single, two-person, or family coverage. You will now have a rate that represents every individual on the policy. The state has specified rating regions. So where there were 8 before, I believe there are now 16 rating regions, and those are determined by the state, and they're based on certain demographics. The other area is risk adjustment and risk corridor payments, and reinsurance subsidization. Hard to get that one out. And what this really did was, I talked earlier about risk stabilizers and those things that have been put in place by the government and through the ACA to make sure that there's some stability in this market going forward. And just quickly, a definition: the risk adjustment is a competitive risk-sharing pool that levels the risk pools across insurers by forcing plans who acquire healthier members to subsidize plans who acquire costlier members. And this will be a permanent stabilizer within the small group and individual markets. Risk corridors is a temporary risk mitigation program, and it stabilizes premiums by transferring funds from qualified health plans with gains to qualified health plans with losses. So they don't want anyone raking in the cash on one end and somebody being threatened to go out of business on the other. They don't want those kinds of extremes to exist. So from 2014 to 2016, that program will be in place. And then finally, reinsurance is a program to minimize the rate disruption in the individual market in particular, and that exists again from 2014 to 2016. So, the next slide is a little bit of discussion around the member level rating and what that 3-to-1 really means. So for children who are under 21, they will pay a rate that is about approximately 60% of that of a 21-year-old. And if you have a policy with more than 3 children, you will only pay for the 3 oldest. If you have more than that, those children will not, they'll put a cap on it. So you'll only be paying for 3 children, even if you have more. What becomes complicated is once that child is on your policy, they turn 21, they become an adult, and they get their own rate, and they pay 100% of that rate. So you may have, the example I use is someone with 5 children. So in the first year, that child is maybe 20 years old, and they will pay for 2 adults and 3 children, even though they have 2 more. Once the oldest turns 21 the following year, they will then pay for 3 adults and still only pay for 3 children, even though they have an additional child. Once the oldest 2 are above 21, so we'll say year 4 of them having coverage, they will then be paying for 4 adults and then paying for the 3 children. So it will take several years for them actually to pay for all 7 people on that policy because of the cap on the younger children. But they will be paying the rate of 4 adults as those children reach 21. And potentially more if they keep that policy until all of the children age up. Hopefully those other ones will have jobs of their own by now. They won't have to worry about them. But it becomes more complex in terms of communicating what your rate is, what the impact is going to be to you, but it's something that's important, I thought, to note. Just a quick word about the tobacco surcharge. Blue Cross, that option is available, but Blue Cross is taking the approach that we will not be using the tobacco surcharge in 2014. Administratively, it's just kind of a nightmare to implement, and we have other programs to help smokers quit. So we're just not going to be taking advantage of that in 2014. Just a quick word on taxes and fees. There are 6 that we have listed here that will be imposed. One of them is not going to be imposed until 2018. So number 4, you can kind of put out of your mind for right now. It is the high cost health plan tax, and it's often referred to as the Cadillac tax. We think that there will be additional changes either to the definition or changes to policies that are offered to make sure that employers avoid that altogether. But the others will be effective primarily in 2014. The comparative effectiveness fee actually went into effect this year, and for self-funded employers, they're going to need to submit that payment directly to the government for those employees. It starts off as $1 and increases to $2 per member per year, and the others are a little bit more significant in terms of impact, but I'm again going to reserve that because that'll be covered in more detail elsewhere. I have some definitions for these as well, but that will be covered by one of your other speakers. So just keep in mind how many there are and that they have a varying impact, and you'll see them beginning next year on your rates of bills, especially if you have Blue Cross coverage. We're already communicating to our groups that you will see a line item on your bill that reflects the new taxes and fees. So the next topic I want to touch on is new hire waiting periods. So this is again a mandate that we've gotten information on very recently for plan years beginning on or after January 1st of 2014. A group health plan or group health insurance issuer cannot apply any waiting period that exceeds 90 days for employees eligible to participate in the group health plan. So if you have part-time employees that are currently not eligible for coverage, once they become full-time or whether their status changes so that they become eligible, they cannot wait any longer than 90 days after they become eligible to get coverage. So there are several things that we're working on right now to make sure that we're communicating to any groups that we've identified that have a waiting period that exceeds 90 days. And this becomes very complicated if you start applying specific scenarios to it. But the government has given some examples through the IRS website about circumstances when It could potentially get close to 90 days, but it really is kind of a flat rule that as long as they are not eligible, you're not really counting yet. It's once they become eligible, the clock starts ticking, the waiting period cannot exceed 90 days. Okay. So, did I go too far? Yeah, okay. Benefit standards. So, we talked about essential health benefits previously in those 10 categories. In 2014, in the individual and small group market, they will have access to these essential health benefits. In 2016, groups that are 51 to 100 who will now be included in that small group definition, they will also be required to offer essential health benefits in their entirety. Currently, large groups they're not required to comply with the essential health benefits, but again, most of those plans already offer most of the categories that are identified as essential health benefits. The next important point is that qualified health plans must hit metal levels. That applies to individual and small group in 2014 and those that are 51 to 100 in 2016. There's a maximum deductible limit of $2,000 to $4,000, and they've allowed some groups to exceed that in order to hit those very tight actuarial values, but for the most part, the deductible limit will be similar across plans and fall into those categories. Now, this next line is an error because this was a change that came down, and it's just something we missed in our review of the slides. But the government issued, or the IRS in particular, issued a statement saying that plans have to integrate all cost sharing for essential health benefits to a single out-of-pocket maximum, and that limit for single coverage is $6,400. The slide says $6,350, but it's $6,400, and for family coverage, it's $12,800. It was another government agency that gave us the original numbers that you see here, and that's just something that the government does from time to time, is they don't always talk to each other and make sure that they're clear about the guidance that they give. But we want to make sure that that's pointed out, because if you represent a self-funded plan, you need to move forward with the $6,400 and the $12,800 caps. And it means that all of the essential health benefits need to go toward this out-of-pocket maximum. And it makes it much more complicated if you have any type of carve-out arrangement. In 2014, you can keep those carve-out arrangements and have separate limits for the prescription drug coverage versus the medical coverage. But in 2015, all of them need to accumulate toward one out-of-pocket maximum for that plan. And that applies even across large groups who aren't required to offer essential health benefits, but are required to accumulate those dollars toward that one maximum. And then finally, wellness plans. There's new guidance that was issued about that, and I'm actually going to move to the next slide so we can just jump right into that. The final rule on wellness programs was released on May 29th by the Department of Health and Human Services, or HHS, the Treasury, and Labor Departments. And under the rules, wellness programs are divided into two categories: participatory wellness programs and health contingent wellness programs. Participatory programs do not provide a reward or do not include any conditions for obtaining a reward that are based on an individual satisfying a standard that is related to a health factor. So in these types of programs, if you have high cholesterol, if you're overweight, if you're a smoker, there's no separate criteria for you as opposed to someone who is healthy and has a normal weight, not smoking, their cholesterol is just fine. So everybody has access to the same reward. And those types of programs are things like, we want you to take a health risk assessment. We want to find out if you're smoking, but we're not going to penalize you if we find out. Those kinds of programs would fall into that category. The health contingent wellness programs The final rule actually divides health contingent wellness programs into 2 additional categories. So this is the part that we weren't aware of when we prepared our products for 2014, because this is coming pretty late in the process, these definitions. But it requires an individual to satisfy a standard related to a health factor to obtain a reward, or it requires an individual to do more than a similarly situated individual in order to obtain the same reward based on a health factor. The annual reward available under a health contingent wellness program may not exceed 30% of the cost of coverage, and if the health contingent program is tied to tobacco cessation, an additional 20% incentive may be provided. So smokers can get up to a 50% reward if they quit. And what this really represents is that if you have high cholesterol, you're overweight, you're a smoker, in those cases, you will have to do something different in order to obtain the same reward as someone who does not have any of those health factors, but you both have access to the same reward. This becomes more complicated in terms of how do you design something that looks this way, but we've done that already in our Healthy Blue Living product that was released several years ago. So it actually is compliant with this rule. But we had some other products that we created that really tried to address how do you get people to improve their weight or stop smoking and some of those other things. And we've decided to close those products because they created a separate level where individuals who continue to have those problems, even if they were working on them, would not have access to the same reward. So we've decided to move away from offering those products for now. But as we understand this definition a little bit better, we may have some new products that are introduced. So this next slide really just talks about the difference between participatory and health contingent. The call-out box on the right is really to show that there are activity-only and outcomes-based plans that can be offered as a health contingent wellness program according to the final rule. And what the working knowledge we had is that you must create a product that gives a reasonable alternative to individuals to receive the same reward as someone who doesn't have health conditions or health factor, so that everyone has access to the same reward. And one of the comments is basically everybody gets a trophy. Nobody gets punished initially for any health factors that they may have because they'll all have access to the same reward. But we may see changes in that space, or at least some more creativity in what's offered in the wellness space in the future. So I'm just going to quickly wrap up with a couple of slides that talk about what we believe is going to be the shift in the market. So right now in Michigan, there are about 1.2 million people who are uninsured today, who are under 65 and not eligible for Medicare. And in that space, we also have a Medicaid population, there's Medicare, there's an individual market and a group market. So all of the blue boxes are the people who have some type of coverage, the gray boxes are those who don't. So what we think is going to happen, as long as the state passes the Medicaid expansion bill, we believe that there will be a number of people, about 440,000, who will now become eligible for Medicaid, and they will move into that Medicaid market. The next shift we think, and this is going to be the largest, is that those who fall into the income categories that we talked about at the beginning, those who are 133 to 400% of the federal poverty level, those individuals will likely go to the individual marketplace to purchase coverage because they now have access to assistance that they didn't have before. So that's going to increase the individual market to well over 1 million people in Michigan. And then finally, we do think that there will be some instances where smaller groups who don't face a penalty for not offering coverage will actually drop coverage. And in that scenario, they will move then from the group market to the individual market. There may be some employers who say, my employees would actually be better off. They went to the individual marketplace, got some subsidies or tax credits, than if I tried to offer it, and it's really not sustainable for me and my business to continue to offer coverage. So they may make that decision. We have a process in place to kind of help them through that transition and offer some consultation. But we want to be prepared for whatever is best for the group, whatever decision they make. We want to be prepared to assist them with that. And just quickly, in my appendix, I wanted to give you some numbers as a point of reference around federal poverty level. Those words are kind of thrown out there, but you're probably thinking, what does that really mean in terms of income? So on the first line, 133% of federal poverty level is $15,971 as your income, up to $32,734.50, up to $400. So people who fall in that income bracket would have access to subsidies or tax credits on the marketplace beginning next year. If you're a family of four, $45,960 is kind of that bottom rung, 133% of federal poverty level, up to up to $94,200 for a family of four. So some would say that's a decent income for a family of four, but you would still have access to this. So that is something that is, to some people it may be very exciting, that they will have the opportunity now to extend or to get coverage and get some financial assistance to be able to cover their family members where they haven't before. And that is all that I have for today. And we'll have questions at the end, so I hope you were writing them down if you had them, and we'll be sure to address them.
Thanks, Alisa. I appreciate it. We're going to move on with our program. We're going to have Don McAnelly. He's principal in charge of the Rehmann office in Saginaw. Don serves as a leader in his firm's healthcare advisory group. In addition to extensive accounting and tax experience, he also has significant healthcare valuation experience and is the firm's expert on the Patient Protection and Affordable Care Act, which is Obamacare. A recognized authority on healthcare-related matters, McAnelly speaks regularly on the topic to organizations such as the Michigan Medical Group, Managers Association, the University of Michigan Dental School, and Chambers of Commerce and business associations around the state. He has also been published in numerous healthcare-related publications with a recent focus on healthcare reform. So I'd like to introduce Don McAnelly.
Good morning, everyone. Thank you for being here today. I'd like to thank the other presenters, Gary and Alisa, Bay Area Chamber. I appreciate the opportunity to come speak with you today, and thank you guys for being here as well. With everything that's going on in this area, this is really a scary time. How many of you guys are scared about what you heard? What do you guys got to be scared about? I'm the one up here speaking right now. I should be the one being a little bit nervous right here. I'm glad to see some friendly faces out there and help us get through this a little bit, and hopefully I won't muck up this little thing right here. Let's see. Oh, good. I got the first one. Hey guys, little quiz to start us off here. By a show of hands, how many think that the Affordable Care Act requires employers to provide health insurance? Anyone out there? Hey, okay, I've got a few out there. This is remarkable. I've given this speech to several people. In fact, yesterday I was at the Kellogg Center at Michigan State University, part of a panel discussion on this. And I gave this same question there, and a lot of people said, yes, the Act requires businesses to provide health insurance. And that's not the case. It does not require a business to provide health insurance at all. Okay, we're going to get into this a little more. Alisa touched on this a little bit, but that was a common misnomer that I saw earlier. Is the Act applicable to nonprofits and governmental units? How do you guys feel about that? Is it applicable to those? Yes, the answer is yes. It's applicable to all employers. Okay? Does the Act require you to offer coverage to an employee's spouse? I'm hearing some no's out there. That one's a little scary. That is correct. The Act does not require an employer who opts to offer coverage to offer it to an employee's spouse. Okay, so if you have a spouse who's an at-home person who stays at home, perhaps taking care of children, okay, this act doesn't require the employer of the working spouse to cover them in health insurance. That's going to be a little bit scary to see how that factors out. How about an employee's dependents? I think this one's a little bit easier. Does the act require that you cover employees' dependents if you offer insurance, that is? The answer is yes. Remember, it's until age 26. They're never going to leave home. They have got health insurance until age 26. Man, oh shepherds. So I'm the CPA in this presentation bunch. Let me make sure if I got this. And I'm going to cover with you guys. I'm going to try to keep it light. I'm going to try to keep it loose. This is some pretty heavy stuff. I'm going to spend about 15, 20, maybe 25 minutes at the very most. I appreciate your patience. I know it's difficult to sit through these. I've sat through many of these presentations myself. And as Alisa mentioned, we're going to have an opportunity for questions at the end. So my topic is just how is this going to all get paid for? Okay? Who's going to pay for this whole thing? Well, taxes is, of course, what it's going to be. First one came into effect in 2010. Maybe it impacted some of you, the new tax on tanning services. Okay, that was a real frustrator for guys like me. I like to get out to the tanning booth, maybe like you guys do, and kind of bronze up a little bit for the springtime, and bam, I got a 10% tax on top of that one. So that one really hurt right off the bat, 2010. Another thing we have right here is a penalty, presenting the cost of health insurance on your W-2. Any CPAs in the audience out here? Do I have any brethren? Got a few brethren. Good to have you in the back of the group there, guys, just like church here for you guys. One of the things that hit here was there's a lot of little stealth things in here, little penalties. If you're a business that prepares over 250 W-2s, you got to put in the cost of the health insurance, not just what the business pays, it's what the business and the employee pays, the full cost. It's got to be reported on the W-2. And if you just so happen to forget about it, just so happen to not get around to it, the IRS is going to be there to remind you with penalties of up to $3 million. That's a lot of smack we're talking right there. I'd hate to be the CPA that was in charge of preparing W-2s for someone, because it's not usually high realizing work for most of us in the CPA field. And forget to put that on there, boom, you got a $3 billion penalty potentially looking at you in the eye. There's a business ender right there for you. Expanded 1099 reporting. There was a lot of talk about 1099s were going to require to be just about on anything over $600. I'm seeing some head shaking. You guys remember that? That was repealed. It's gone. Thank goodness. Pharmacy manufacturer credit. So the Mercks, the Pfizers, those types of large pharmaceutical manufacturers, they've got to pay $2.5 billion in 2011. Up to 4.2 in 2018. So you're seeing, you might be seeing some of their cost structures changing. That's going to impact the costs that they have to pass on. Remember, all taxes are ultimately paid for by people. They're not paid by businesses. They're paid for by consumers, okay? So they're ultimately going to have to pay, we're ultimately going to have to pay for these additional taxes in the pharmaceutical thing. Another thing I threw in here was Medicaid expansion. Alisa mentioned this a minute ago. The state of Michigan is looking under some pressure to expand Medicaid, to get upwards of 450,000 additional people into that. I believe the House has approved it. It's waiting for the Senate. There's a little bit of a carrot there. The federal government's going to cover it for, I believe, 3 to 4 years, and then it becomes a state issue at that point in time, a lot of the additional costs. So that's the real concern. It might seem like a no-brainer. Oh boy, it's free money from Washington. Let's take it. But in a few years, that free money goes away, and it's not going to be there, okay? Another thing that came out in 2010 were small employer health insurance credits, okay? And this was something that the federal government put in place to help those smaller employers, those with roughly 25 employees or less. They'd have an average wage of, I believe, less than $50,000. If they were offering health insurance coverage to their employees, they were able to access a credit for offering that. We didn't really notice in the CPA side of the business that many businesses could get this credit right here. It isn't something that I think was really, it didn't work out, I think, as the federal government has hoped. There were very few people that actually ended up getting this credit, And there's 2 phases to this. The credit sweetens up a bit in 2014 to try to help smaller employers, encouraging them to continue to provide health insurance. So these are people with below 50 full-time equivalents, okay? Those are the ones that got this credit. Another tax which was set to be effective the beginning of this year is a 2.3% medical device excise tax, okay? And this one was a terribly confusing item. What the heck is a medical device really came down to it. Now, if I said to you, you know, it's a hip replacement, it's a knee replacement, you guys would say, oh yeah, those are medical devices. If I said to you it's Band-Aids, it's dental floss, and it's teeth brushes, you guys might say, what the heck, those aren't medical devices. Well, that was the big issue. The only thing that the Act exempted were hearing aids, eyeglasses, contact lenses, and anything that the Secretary of Health and Human Service shall determine to not be subject to the tax. So pretty nebulous stuff right there if it's left up to that person right there. There's been some discussion within Congress about getting this act kicked out. You know, on the west side of the state, this was a real big concern over there. There is a large medical device manufacturer, which I'll nameless for the purposes of this discussion, but they were anticipating that this was going to be about a $100 million hit to their bottom line. Guys, that's real money when you're talking $100 million to any business, okay? That's research and development costs. That's high income jobs. You know, our sons and daughters that are maybe getting into engineering, you know, they're not going to have the opportunities because businesses are paying for this tax. So this 2.3% medical device excise tax is a huge issue. Okay. Other things that are here to help pay for this tax, as Alisa mentioned, some of these things are going to kind of stack on one another. The first thing that you have here that's really received kind of the bulk of the discussion in the media has really been this play or pay. That's tough to spit out sometimes, taxes. And what it really gets down to is that businesses right now, and I'm going to touch upon this in a little bit, need to be ascertaining who they need to be offering coverage to or pay a penalty, okay? So the $2,000 excise tax, remember this was the big issue that the Supreme Court decided on. Is it a penalty? Is it a tax? Okay, this was the big thing that they were looking at. So if a business decides to not offer coverage, okay, they're going to pay an excise tax of $2,000 per full-time equivalent in excess of 30. Okay, guys, way too complicated to get into all the math and the minutia in 25 minutes right here. But they're going to pay an excise tax. Okay, if they're not offering it, if they offer coverage and it's deemed to not be affordable, well then they're going to pay $3,000 per employee who gets a credit on the exchange. You know, one of the scary things that I find out there is that, as Alisa mentioned, most large employers that offer coverage above the actuarial 60% limit. You know, she was talking about those tiered, those metal tiered, and said 60%. Remember that, you know? So in order, you know, the coverage has to be affordable, 9.5% of a person's income, a little more technical than that, and it has to cover 60% of the costs, okay? If it doesn't, one of the issues that you'll have, I believe, is that some employers are covering much more than 60. They might ratchet that coverage down and say, you know what, there's finally a bar there. I'm going to cover 60%, I'm going to cover 9.5% right now. Employees might be a little bit surprised as to where their costs go under that scenario. Employees then might believe, I might be better off to go to the exchange and then try to access coverage on the exchange, right? Basically, they're going to become consumers on the market. They're going to go to the healthcare marketplace. They're going to access coverage. Well, if they go to the healthcare marketplace, maybe get a premium credit, okay? And at a future date, it's determined that, hey, your employer offered you affordable coverage that provided minimally essential benefit. You shouldn't have gone to the exchange. You should have stuck with your employer. And oh, by the way, those credits you got, you owe me some money back. This is Uncle Sam talking to you, okay? This is really, the only way to describe this includes the word cluster within it. And I'll leave it at that, because I believe 2015, for us in the CPA field, 2015 is going to be a boom year for us. Because, you know, every time there's a new tax act, I get a lot of people come to see, boy, when they go to a flat tax, you guys are going to be out of business. And I say, oh man, you're right about that. I'm nervous about that myself. Every time there's a new tax act, it multiplies in the complexity of it all, and it just adds more and more work for us to do. And I can see 2015 being an ultra scary year for many people, because we're going to get a lot of notices, I believe. Hey, touching upon a few other things that have really hit. You've got the Medicare tax increases. Okay, this one hit this year. Okay, some of you in the room are impacted by this. First one you have is a high income Medicare tax. That's on earned income. Okay, so that's your W-2 wages, your partnership income. Okay, and that's an additional 0.9%. Doesn't sound like a whole lot. 0.9%. Well, you know, I find if it's 0.9% that I have to pay, it means a lot more than if I'm giving it to you. You know, it seems like a lot more money to me than it might be to you. And what that relates to is that if you have an income level, if you're married filing joint and you have an income level of 250 or above, you're going to pay this tax on your income above that level. Okay? So if a married couple makes 400 grand, say they're both high income, they got 150 they're going to pay on. They're going to pay that 0.9% tax on. You can see the income thresholds for married filing separate, and then for single and head of household. An important point here, I believe, is that these thresholds are not indexed for inflation. Okay? And right now, $250,000 to many of us probably seems like a significant amount of income, and I believe it is. I'm not meaning to downplay that. But I think what you're going to see is as time marches on, more and more people are going to be subject to this. I'm seeing some head shaking. I remember when I got out of college and I started working, I thought, man, if I could ever make 50 grand a year, I'm going to have the world by the you-know-what. If I only made 50 grand a year, I wouldn't have hardly anything, it seems. I'd be in the federal poverty level right there. Maybe I'd get coverage for my health insurance, so I would have something at that point in time. So what I'm getting at here is with, you know, everything's going to index up, and there's going to be more and more cost to virtually all of us, I think. Net investment income tax. Guys, this is a 3.8% tax that's going to be levied for the first time on net investment income. And that includes your interest income. Who gets interest income anymore? My apologies to the bankers out there, but no one really gets interest unless it's a private loan of some sort. Dividends, yeah, there's a lot of dividends to be had. Capital gains, annuities, rents. Now, rents, there's certain types of rent it's applicable to. Royalties, passive active income. Did he just use the word passive active income? Yes, I did. And sorry for that, guys. And self-rentals, there's some specific issues regarding that. What I'm getting at here is that this tax is going to be applicable to your mailbox money. You know, I had a client one time tell me, man, when I'm getting older, I need mailbox money. I said, what is mailbox money? He says, well, what do you think it is, Don? It's when you go to the mailbox and boom, there's a check for you. This is mailbox money that they're going to start to hit right now. And we all need mailbox money as we get older because it's nice to have that income that just comes in for doing nothing. Another big issue you have is controlled groups. Those of you that are business owners out here, I think you really need to listen to this one. If you have multiple businesses, and I see quite a bit of this in our practice at Rehmann, if you have multiple businesses and you think, this is wonderful, I've got 30 employees in 6 different businesses, this act isn't applicable to me, okay? I encourage you to rethink that, okay? There are what's called controlled group regulations in the IRS code where you have to look at it, and you have to look at all of your businesses together. So if you think you're going to get around this because you parceled up your businesses because they're separate, they're unrelated, that's really not going to work. Another thing, too, that I want to advise you that's not up here on my presentation is that, you know, a lot of people try to work with independent contractors and say that someone isn't an employee, they're an independent contractor within your business. If you have a situation where you're relying upon independent contractors to a significant degree and you believe they're independent contractors, or that's what you want to believe they are, because you don't have to provide health insurance to independent contractors, you need to be cautious. Okay, the IRS likes to peer right through those, okay, and say they're not independent contractors, they're really employees. So you need to take a look at that as well. Cadillac tax, Alisa touched on this earlier. There's going to be a tax on ultra high cost health insurance at a future date. You know, I'm most concerned about this one within our municipalities and our school districts, those types of areas. I see some people in the audience that are in that industry, if you will, and this one concerns me there. You know, many of our municipal governments and school districts, they all offer a very nice health benefit, and I think that they might find themselves running into this one here at 2018 when it becomes effective here. So that's one that's 4 years down the road. I had someone stop me at a presentation saying, how do we plan for that? And I'm like, hey, listen, we got to get the car out of the garage before we plan how we're going to run NASCAR this summer. So, you know, we got to figure this one out a little bit first before we get to that one. Let me make sure. Oh, hey, flexible spending accounts. How many of you guys use flexible spending accounts at work? You know, I remember a few years ago, my wife and I have 3 children, and any of you guys have to go to the orthodontist with your kids? That is a heck of a nice surprise, isn't it? And when the orthodontist says, you know, we're going to make your young daughter look good for $6,300, what do you as a father do? You sign on the dotted line and you get orthodontic treatment for your daughter and or your son. Well, thank goodness in the past there were flexible spending accounts that you could put money away on a pre-tax basis and have the federal government, Uncle Sam, pay for a little bit of this. This one kind of went away in 2013 and beyond. There used to be no limits. A business could have unlimited amount of money you could put away into a flexible spending account. Now there's limits. Okay, you got a $2,500 limit. You've got a 20% excise tax. It's supposed to say a non-qualified distribution. So if you took money out of your account and wanted to go to the movie theater or go out to dinner, you know, it doesn't really count. You're supposed to pay an excise tax on that. And over-the-counter products are no longer eligible in there. Remember at the end of the year, you used to run your favorite pharmacy and kind of get whatever you needed because it was use it or lose it on your flexible spending account. Yeah, you guys know what I'm talking about. Hey, you know, that's no more over-the-counter products, so that little benefit was gone right there too. One of the hallmarks of the Act talks about individual responsibility, okay? It's an individual's responsibility to have health insurance. Unless they're below 133% of the federal poverty level, then they're eligible for Medicaid. Unless they're on Medicare, unless they're religiously opposed, I believe one of them is, so I think that must be Amish or something like that, or unless they're in the big house. So if you're really against this, you do something to get yourself thrown in the slammer. You'll be all set here next year. The penalty, the individual responsibility that hits for the individual really is going to manifest itself in this kind of pittance of a penalty that Alisa touched upon earlier, okay? In 2014, there's going to be an excise tax or a penalty. It's one and really in the same, guys. And it's going to be $95 per adult, $47.50 per child, up to $285 per family, or 1% of the family income, whichever is greater. You guys could see some of those thresholds that it's set to go up to over the next few years. So this penalty is not really overly punitive, it would appear, from the onset for most people. Okay? But that's one of the other revenue raisers is they're looking to see to get these people to pay. You got to wonder, if a person's income is so low and they don't have health insurance, you wonder if they even file a return, but I guess many of them would to get some of the earned income credits and whatnot. So there's going to be some penalties out there, and this is really going to make it, I think, challenging for a lot of people to prepare tax returns. Now you got to attest to the fact that yes, I had health insurance for the entire year. A couple other small things that's going to happen here. Changes in your ability to deduct medical costs on your tax return. Used to be a threshold of 7.5% of your adjusted gross income. So to the extent that your medical costs exceeded 7.5%, that was always one that was kind of a misnomer to a lot of people. To the extent they exceeded that cost, then you got to deduct those costs that exceeded it. Now that threshold goes up to 10. You know, in practice, I really don't see a ton of people getting benefit from this. The only people who I really see are those that are senior citizens that are in assisted care, nursing home type of things. Those are the ones that I've really seen getting a benefit out of this. But as more and more cost sharing gets pushed to the individual, you know, we might start to see this hitting a little bit more and more. Got a couple more spots right here that I'm going to talk about. We talked really about the taxes, and guys, we just I could have stood up here for 4 hours. You guys would have left about 3 hours ago had I done that. So I kind of kept this at a kind of a top level approach right here, and we've gone over the taxes, many of the taxes that are applicable, not all of them, okay? And we've only gone 1/4 of an inch deep with all of these things. But there are also some fees that are applicable. Lisa was mentioning during her presentation some of the fees that are going to be applicable. I mentioned yesterday being at the Kellogg Center, and there was a gentleman from the McLaren Health Plan who indicated that they're anticipating an increase in the cost of their plan of 6% just due to these fees. Okay? Remember, one of the things that it was said that this health insurance law was going to help us make costs affordable. That, by golly, that's in the name, the Affordable Care Act. But what we're seeing is these fees and everything, you know, the rubber's hitting the road here. We're seeing what's really happening here. We're seeing some fees go into this one. The first one is the annual fee on health insurance carriers. This one is just a fee that's going to be assessed to all health insurance. Blue Cross Blue Shield, HAP, Priority Health, McLaren Health Plan, you name it, they're going to have to pay an additional fee. Remember, that's going to get thrown into the soup. That's going to get thrown into the recipe that determines what the cost that they pass along to us in premiums as business owners and as managers of businesses. Okay, so ultimately, this is going to get paid by you, the subscriber. Okay, transitional relief program right here. What this one is meant to do is it's meant to be a fee that helps to shift some costs towards the insurance plans that maybe are covering higher cost individuals. Okay, so you're going to see that penalty or that fee, come into play right there. Wait, I think I might have messed that one up, but we'll move along anyways because this is the one right here, the risk administration fee, which is to compensate certain plans with membership that are less than healthy than those at average in the average assessing plan. So this one is meant to cover, to transfer some costs. If you've got a group where people are not very healthy and high cost, this is the one that's meant to help cover them. So you're going to see some shifting of these costs in this area. The PCORI fee is going to be set. Alisa mentioned that this fee hits this year. This one's really important. It's kind of a stealth little fee. It's $1 per member per year. Not a big amount of money, but I'd hate to be the person, I'd hate to be the company that forgot to pay this. Any of you who are self-insured out there, you need to be aware of this one. I suspect your claims administrators are probably keeping you up to date on this one, but this one I believe is due using IRS Form 720 by the end of July. So you've got some time on this one, but you need to be on top of this fee that comes due. An exchange user fee is the next fee. There's going to be a cost to people that are using the exchange, which is going to get called the healthcare marketplace too. Remember, this is going to kind of be like e-insurance. Okay, you're just going to go online. Presumably it's meant to be easy. I understand that 23 pages worth of entry is what I heard the first go around was. So these people are supposed to have high-speed internet connections and be able to access this. That's going to be a tricky one to work through. So you've got these, in addition to the taxes, you have these 5 additional fees that you're going to have to start to pay 2013 and 2014 that are set to help fund this health insurance. Okay. Now I'm going to conclude here. I've got the top 8 things. I couldn't think of 2 more, so I left it at 8. Okay. That a CPA would want every business to consider. Okay. Number 1, does your business need to begin to withhold the extra payroll tax for high-income people? Okay. And the answer is yes. Okay. You do need to begin withholding that. So if some of you are in payroll and you've got high-income people at your business, you need to begin to withhold a little bit extra tax from them. Now, you don't have to factor in what a spouse makes and withhold that extra for that spouse. You're not required to do that. But if you've got a business owner and say she makes $400,000 a year, yes, you do need to begin to withhold that extra high-income tax. What is the measurement period? I think Gary's going to touch upon this piece right here. Guys, this is one of the most important takeaways I think that you can have from this entire presentation today. We are in a phase of the Act called the measurement period. Okay, imagine a timeline in your mind. Okay, go back in time to October 15th, 2012. Okay, the good old days. Okay, imagine a 1-year period from October 15th, 2012 through October 15th, 2013. Boom, we're smack dab in the middle of the measurement period right now. Guys, what you need to be doing as business owners, management, is taking a look at your employees under this measurement period. What the measurement period does is you're looking to do a couple things. For those of you that are maybe on the cusp of being a large employer, more than 50, okay, that's the way that you determine, am I over 50? okay? And there's some real complex set of rules and regulations here, okay? It's not a one-size-fits-all approach. Don't let anyone fool you. If you rely upon seasonal employees in your business, you might have an issue. If you're a college or university and you have adjunct faculty members, you might have an issue, okay? So there's a lot of different things that you need to be concerned about, but ultimately what you're looking at with this measurement period is trying to ascertain if I have more than 50 full-time equivalents, okay? You're going to start to hear some different verbiage. Part-time people are called variable hour employees under this act, okay? And a full-time equivalent is a person who works 30 hours a week on average, okay? Doesn't matter if your plan says 32, says 40 hours as a full-time person. That doesn't matter. It's 30 hours a week right now. That's going to be the full-time equivalent, okay? The other thing with the measurement period is it's going to determine who you have to cover once we hit January 1st, 2014. Let's talk about the administrative period before we get to that. Go back to the timeline I gave you in your mind. Once October 15th hits of this year, okay, you're getting ready for Halloween, okay? Now you're in the administrative period. This is the period of time that you've determined within the measurement period who works 30 hours, who I have to offer affordable and minimally essential coverage to. Now you got to get them enrolled, okay? You got 2.5 months to get them enrolled. Then we hit January 1, 2015, we hit the stability period, okay? The stability period, again, measure a timeline, is a period of time that has to be either 1 month longer than the measurement period, during which you have to cover the people who are eligible, who are determined to be eligible under the measurement period. Okay, so I am really cutting this to the quick here, guys. I think Gary will get a little bit more into it. But that's the point in time where you begin to cover people. There's going to be some questions out there. You know, Sally worked for me during the measurement period full time. Then during the stability period, she went to part time. Okay, nope, still got to cover Sally. Got to offer her coverage. Okay. Now, when we're in the first stability period, we also begin measurement period number 2. So this, for those of you who are in administration, this is going to be an area that is going to be constant for you, determining who's eligible for coverage and who is not, and who we have to cover. Okay? So those are the first 4 things that I would want you to know. Multiple different businesses with common ownership. I talked about controlled groups a little bit earlier. Guys, if you have multiple businesses, you need to be talking with your trusted advisors, your CPA, your attorney, regarding that issue. This is a huge issue that's waiting to bite someone really big here. So if you've got multiple businesses, you need to be concerned about this. Should my business consider the shop exchange? Okay, Alisa mentioned earlier shop exchanges, Small Business Health Options Program. And this is something that's going to really be interesting. I really agree with you here on this one, Alisa. I think you're going to see a lot of businesses that are smaller, below 50 employees, that are going to think about their health insurance coverage and say, you know what? I know what my employees make. I know what I pay for their health care. I could go take them to the exchange. They could access credits if their income level is not at the level. And I, as a business owner, could effectively off some of my health insurance costs to the exchange. You guys follow me there? Okay, so if I'm paying $12,000 a year for some family coverage, say I got less than 50 employees, I know what I pay my employees. I know that Bill, if he leaves, or if I don't have to pay 12 grand, he's going to go to the exchange, right? Because he's got to have coverage. We're going to go to the exchange, and Bill's going to find out that health insurance is going to cost him 4 grand. The government's going to pick up 8 of it. I'll pay Bill an extra 5 grand. I'll cover some taxes for him. He'll net 4. He'll pay it. Boom! I've saved 7 grand. Okay, I've just offed it to the taxpayers at that point in time. Okay, I think we might start to see some of that. I've heard some rumblings. The shop exchange might be delayed a little bit here, but I think we're going to see this. That's an important takeaway from this: is keeping your eye on the shop exchange, particularly if you're a smaller employer who might be thinking, you know, I'm just going to leave the health insurance up to my employees. Reporting required to the IRS. Guys, there's going to be a lot of reporting required. The first thing that hit us was the W-2 reporting. A little bit ago, I mentioned 250 W-2s. Okay, there's going to be some reporting that's going to hit in January of 2015. Okay, that's a year and a half from now. We might be thinking that's an eternity from now, but there's going to be some reporting that's going to go there to say who you covered, how you covered. I don't know what it's going to look like. I kind of think it might look like your unemployment, your state unemployment reporting, if some of you do that on a quarterly basis, where you list everyone's name, social security number, and what you paid them. I think it's going to kind of be something like that, where you're going to report who you covered, okay? Because the government's going to have some way of determining who had coverage from an employer, who had coverage from the exchange, okay? Who had affordable coverage from their employer, who didn't, who went to the exchange when they shouldn't have gone to the exchange. Guys, there's going to be so many moving pieces here. I can see 2015, as I mentioned, I think the U.S. Postal System, it's going to be a banner year for them, because you're going to have all different notices coming from the IRS to businesses saying, oh, you owe us a penalty because 8 of your employees went to the exchange. You had over 50 employees, 8 of them went to the exchange. You owe us $3,000 times 8. Please pay us $24,000. You're going to open up that IRS notice, because there's few things in life that make your heart skip more than when you see that IRS letter in the mail. And when you see that and they say, please pay $24,000, you're going to call your friendly CPA, then you're going to start a letter writing campaign, because Lord knows you can't make a phone call to them without being on perpetual hold for about 3.5 hours. So you're going to find yourself writing letters there, and I think you're going to see an awful lot of issues right here happening in first quarter into second quarter 2015, is really all of this stuff starts to get sorted out, because there is a tremendous amount of information that's going to need to be relayed between individuals in the IRS and businesses in the IRS. Guys, we spent, hopefully I kept myself to 20-25 minutes. We've glossed over a tremendous amount of important things within this time frame. If one piece of advice, or 3 pieces of advice: plan, plan, and plan, okay? This act is going to impact you. Even if you have less than 50 employees and you're thinking, boy, we got a free pass, the act will impact you. It's going to impact all of us. As business owners, as business leaders, I think it's incumbent upon us to be planning for it and to understand how it's going to impact our business going forward. Thank you very much.
Thanks, Don. I appreciate it. We're going to keep moving right along here, try to stay in our time frame. I want to introduce Gary Gudmundsen. He's a partner with a local firm of Braun, Kendrick, Finkbeiner. Gary is experienced in healthcare law, general business contracts, healthcare law, and assists clients with various healthcare-related issues, including fraud and abuse, HIPAA, reimbursement, and joint ventures. Gary is originally from the Great Lakes Bay region and is involved in several local associations, including the Home Builders Association and the Michigan Sports Unlimited Hall of Fame. No further ado, Gary Gudmundsen.
Morning, everyone. Thankful for Don and Alisa's comments to this point. I'm going to, in keeping with the time, I'm going to try to keep my comments brief and to the point. We've already undergone some review of what I'm going to share, but delve into a little more detail. What I'm going to focus on is the employer shared responsibility provisions. Sure got that. We're going to talk about whether or not you're a covered employer, what that means. You'll hear the term applicable large employer thrown out there a lot. If you're an applicable large employer, then you really have to be concerned about these employer shared responsibility provisions. If you're not, then perhaps you can lend a shoulder to someone who is, so that they can cry on it a little bit for some of the pain that they'll have to undergo. But beginning in 2014, employers who employ a certain number of employees are going to be subject to the employer shared responsibility provisions under the Internal Revenue Code. And under these provisions, as it notes on the slide, if these employers don't offer affordable health coverage that provides a minimum level of coverage to their full-time employees, they may be subject to an employed shared responsibility payment if at least one of these full-time employees gets a premium tax credit or cost-sharing subsidy through the one of these insurance exchanges. So first, let's talk about how one goes about determining whether you are a covered employer. As you've heard already, a covered employer is an employer who has 50 full-time and or full-time equivalent employees. You have to go about calculating this number over the course of the full previous calendar year. Because employers weren't given a lot of time to prepare for 2014, there's a special transition rule that applies for that in 2013. So you can, instead of using the entire 12-month period, you can use any 6 or more consecutive months in order to determine whether or not you are a covered employer for 2014. In future years, it will require use of all 12 months in the calendar year to do that. And that could be problematic because, of course, come November, that's going to include November and December months, and you know, you're at that point in time, you're kind of on the cusp of the next year, and so you're going to be bumping into some deadlines. Which employees are you going to include in looking at this? You're going to look at your common law employees. You're going to look at employees of all related employers using the controlled group and affiliated group rules. So you're going to need to look at related businesses, parent subs, brother sister companies. You're not going to have to count, however, sole proprietors or partners, independent contractors, leased employees. In order to determine full-time status, this is an employee who performs on average at least 30 hours of service per week. And the IRS has said 130 hours of service in a calendar month is treated as a monthly equivalent of at least 30 hours of service per week. And an hour of service includes each hour for which the employee is paid or entitled to payment for the performance of duties, or for a period of time in which no duties were performed, but they were provided paid leave. And for that, all intents and purposes, all periods of paid leave have to be taken into account when you're determining the number of hours of service that are applicable to each employee. In order to determine whether an employer is an applicable large employer, you are required to calculate the number of full-time equivalent employees that were employed during the previous calendar year. And you count each one of them as one full-time employee in determining your 50 employee threshold. And to calculate this in any given month, you will add up the total number of hours of service for all employees who were not employed on average of at least 30 hours of service per week. And you can go up to a maximum of 120 hours per each such employee per month. Then you divide that total by 120. And the resulting number is the number of full-time employee equivalents for that month. Then of course you're going to extrapolate that out to the full year in order to determine and factor them into the total number of employees that you have employed during the calendar year to determine whether or not you're an applicable large employer. And we'll see example here. So for the calendar year, you're going to take the total full-time employees plus the full-time equivalent employees, including seasonal workers. There's an exception that applies there. For each calendar month, you're going to divide by 12. Then you're going to round that down to the next lowest whole number. So they're not making you round it up, they allow you to round it down. And if that result is over 50, then you are an applicable large employer for the current year, unless the seasonal worker exception applies. Let me mention what that is. If an employer's workforce is greater than 50 full-time employees for 120 days or less during the calendar year, and the employees in excess of 50 who were employed during that period were seasonal workers, then you're not an employer, you're not an applicable large employer. May take a little bit to digest that, but that's the formula that they've allowed for the seasonal employee exception. So it essentially allows you to carve out those who are truly seasonal employees from the calculation. And if you end up under the taking them out and your number is under 50, then you're not an applicable large employer. So here's an example, I think, of the calculation. So say you've got 30 employees who average 40 hours per week. You've got another 10 who average 30 hours per week. Then you have 20 who average 25 and 4 who average 15. So you've got, out of the gate, you've got 40 full-time employees. And then running the calculations, that 4.2 figure is just a matter of extrapolating that out to the month. Between the full-time equivalent employees, you've got 19.6. And so all told then, remember you're going to round down that fraction, all told you end up with 59 full-time employees or full-time equivalent employees for purposes of determining whether or not you are a large employer subject to the employer mandate and penalties. So if you are a large employer, you kind of fit into two categories. And that first arrow pointing towards me, I believe, should say play or pay, not play and pay. But essentially it comes down to, are you going to play or pay, or are you going to play and pay? You're going to be liable for these penalties if you, A, do not offer health coverage, or you offer coverage of less than 95% of your full-time employees, and at least one of the full-time employees goes out and is eligible for a premium tax credit or cost-sharing subsidy to help pay for his coverage on the exchange. Or you do offer coverage to at least 95% of your full-time employees, but at least one, again, employee goes out and receives a premium tax credit or cost-sharing subsidy on the exchange for coverage because either the employer did not offer that employee coverage or because the coverage that was offered was either not affordable or not of minimum value. And you've already heard a little bit of discussion on what those terms mean. A couple of points here in determining the number of full-time employees to whom you may be required to offer coverage. How do you go about calculating that? This is where Don's comments on the measurement period and the administration period and stability period come into play. First of all, you don't have to worry about the full-time equivalent employees because you're not required to offer coverage to them, just to your full-time employees. So you don't have to worry about them in this calculation. Also, for purposes of the employer shared responsibility, payments is determined on a monthly basis. That's why the IRS has created this look-back period, because it's, from an administrative standpoint, it probably is going to be kind of a nightmare to go on a month-to-month basis trying to determine each month who among your employees are full-time employees eligible and to whom you must offer coverage. So they said, look, we'll create this look-back measurement period so you can go back, set amount of time to test the employer's hours or employees' hours during that period. Then you can have a short time frame in between the measurement period and the stability period in which to make the determination and to notify and get people enrolled. And then you're going to have the stability period, which is whereby you're going to treat those individuals you've classified as full-time as such during that stability period. And you're, like Don noted, this is going to be a continual process. It's going to be, each period is going to be rolling over on a year-to-year basis, and so it's going to require you to get in a bit of a groove, so to speak, administratively in order to keep a handle on this. One note with respect to these periods, each one of them has certain minimum and maximum lengths that are to be selected by you as the employer. The standard measurement period is to be no less than 6 and no more than 12 consecutive months. The optional administrative period is to be 90 days or less, not 3 months, 90 days or less. And the stability period is be not less than 6 months, but no shorter or longer than the standard measurement period. So for all intents and purposes, your measurement period and your stability period are going to generally be the same length, and most commonly probably of 12 months each. That just makes sense from an administrative standpoint. You can go about and change the measurement periods and stability periods so long as they're coinciding with each other, but I'm not sure from an administrative standpoint that would make much sense. It'd be easier to keep them consistent on a rolling over basis so that you have some consistency there. So for instance, and Don alluded to this as well, but you could say your measurement period is November 1 of 2015 to October 31 of 2016. Then you'd have an administrative period there right after the measurement period from 11/1 of 2016 to 12/31 of 2016. And then your stability period would be the calendar year for 2017. And of course, anybody who you've determined to be full-time who are eligible for coverage need to be treated as such during that stability period, no matter if they change status. But again, keeping in mind that during that stability period, you're going to be again in the midst of another measurement period for purposes of determining their status in 2018. So it just keeps kind of rolling. It's like waves coming onto the beach, so to speak. It's going to keep rolling over. Now let's talk a minute about the player pay rules. You'll be liable for payment if for any month the applicable large employer fails to offer the opportunity to enroll in minimum essential coverage under an eligible plan to at least 95% of your full-time employees, and any full-time employee is certified to receive a premium tax credit or cost-sharing reduction for purchasing coverage through an exchange. And the way, and the next one again is a pay and play. You've got pay or play and pay and play. If you offer the opportunity to enroll, tonight again 95% or more of your full-time employees, but the coverage is either unaffordable or doesn't provide minimum value, and the full-time employee goes out and acquires coverage through an exchange and qualifies for a premium tax credit, then you'll also be subject to a penalty. And let's talk about what affordable coverage and minimum value means for a second. For purposes of the tax credit, the affordability, it's not affordable, or I should say it is affordable if the employee's required contribution does not exceed 9.5% of the employee's household income for the taxable year. Now you might wonder, well, how am I to go about figuring out what my employee's household income is for each taxable year? Well, the IRS recognized that, and so they provided a safe harbor whereby you can determine their household income based on the employee's wages from the employer that are reported in Box 1 of Form W-2. So that makes it easier on you. So long as the amount, the annual wages that are reported on Box 1 of Form W-2, as long as their premium does not exceed 9.5% of that, then your plan will be deemed to be affordable. Then also, let's talk about what minimum value means. Because if your coverage does not provide minimum value, then they may be eligible to receive a premium tax credit. This is defined as coverage of at least 60% of the total allowed cost of benefits provided under the plan. So in other words, the plan should meet the same minimum value as the bronze plans that are to be offered in the exchange. Again, there's a couple safe harbors, so to speak, like the IRS is going to be providing, and I think already has, minimum value calculators, where you can have determined actuarially. I understand, though, that there are already some issues with people who've gone out and tried to use these minimum value calculators, that there's been some issues in terms of whether or not the calculations are coming out right. So they still have some things to work on in that regard. So this is just a flow chart which sets out whether or not you are going to be responsible for these shared responsibility payments or penalties. So first you have to determine, are you a large employer? If you're not, then no payment will be owed. Do you offer coverage to full-time employees? If you do, is it providing at least 60% coverage? And is it costing less than 9.5% of the income? If so, no payments due. If it doesn't, then you see the flow chart there. In certain instances, you may be responsible for payment. And let's talk for a minute now about the types of payments that are owed. So the first payment is a $2,000 penalty. That's if you fail to offer coverage or don't offer coverage to at least 95% of your full-time employees. The way you calculate that out for a calendar month, it's equal to the product of $2,000 divided by 12 and the number of full-time employees minus 30. So you get to cut 30 out, but then you have to then calculate it out using that formula. Remember, this is for full-time employees, does not include full-time equivalents or full-time employee equivalents. The next is the $3,000 penalty. You calculate this out as the product of $3,000 divided by 12 and the number of full-time employees who are certified to receive a premium tax credit or cost-sharing reduction for purchasing health coverage through an exchange. But it's capped at the amount the employer would pay if it were subject to the $2,000 penalty. So you're not going to, under this, you're going to pay the lesser of the two if it amounts to that. So just by way of an example, if you have a company with 170 full-time employees, each working 30 plus hours, what if they choose not to provide coverage? Well, they're going to pay an annual payment of $2,000 per employee, and this applies if only one employee receives a tax credit. So only one of these employees has to go out and be eligible for a tax credit. So at the end of the day, excluding the first 30 employees, you're going to look, this company is going to be looking and facing a $280,000 payment for having failed to offer coverage to its employees. Next example. Next example is where they decide, well, we're going to play and offer coverage. But what if it's not affordable? It doesn't meet the minimum value requirements. Well, they're going to pay an annual payment of $3,000 for each employee, again, who's eligible for the premium credit and who purchases coverage through an exchange. So if 11 of them do so, then the company's going to pay an additional $33,000 per year as a penalty for not having met the affordability or minimum value requirements. So that's just a quick, again, brief overview of the employer shared responsibility provisions. And of course, it's just kind of scratching the surface. There are a lot of other minute details, other types of requirements in there, and nuances in these regulations that you may encounter, and this is hopefully provided you with a brief and good overview of kind of the nuts and bolts of what to face.
and gentlemen, first of all, I want to thank Blair Moulthrop, the chairman of your Bay Area Chamber of Commerce Healthcare Reform Committee, for working so closely with Joellen Streeter and other leaders within the chamber on putting this together. Blair, Joellen, thank you so much. What a great program that we've had today. Alicia, Gary, Don, you've done an absolutely fantastic job in terms of really providing a lot of good information to the participants today. Many of you are going to have additional questions. I believe each of the three of them will stay around to be able to answer your questions personally. So please don't hesitate to do that. Also don't hesitate as you get more questions, talk to your CPA, talk to your insurance agent to make sure that you understand how this is going to impact you. Because as you've heard today, one way or another, it is going to impact every single business in this area. Ladies and gentlemen, thank you for being here. We are adjourned.